Hello guys, welcome back to the channel. It's Unit 7 Part E. Gestational diabetes mellitus. During the pregnancy, there are lots of changes seen in the women body like increase of hormone, decrease of hormone, placental growth, fetal growth, exchange of blood, antibiotics. So like that there are lots of change seen in the women's body. In that time there are lots of health issues that occurs in the female body. In that diabetes mellitus is one among them. That is nothing but glucose intolerance. The capacity of women's body digesting the glucose will get reduced. Generally in 10%, 3% of women get this diabetes mellitus, and after the delivery process it will automatically disappear. But after 10 or 15 years, in the gap of 10 or 15 years, there is a chance of reoccurrence of this gestational diabetes mellitus in the form of type 2 diabetes mellitus. That is, soon after the delivery it will disappear. The glucose level will get normal. But after 10 or 15 years, there is an impact that it might come again in the form of type 2 diabetes mellitus. So, this has an effect on both mother and the fetus in various way. Firstly, there is a chance of preeclampsia to occur in the women, and this chance is quite increased when the woman has diabetes mellitus. Not just preeclampsia, eclampsia is also seen, seizures chances is also increased, and infection. As you know, at the time of pregnancy and deliveries, infection is quite commonly seen, and this chance is also quite increased. Mainly endometrium is the common condition seen in this, and the chance of PPH is also increased. Now, what is PPH? Postpartum hemorrhage. After the delivery, the bleeding which is seen, that is postpartum hemorrhage. Because of this diabetes mellitus, the healing process will get reduced, and the tear which is a tear or the wound which is occurred in the delivery process will not get closed fastly, will not get healed fastly. Because of the PPH is seen in the large number, and C-section cases is also increased because of this diabetes mellitus in the pregnant women. Apart from this, there are lots of other things too. Because of this diabetes mellitus, there are other health conditions will also be developing. For example, hypertension, which is quite commonly seen. Hypertension, the chance of developing the hypertension is also seen, and other health conditions like anemic condition in the women or any other hormonal imbalance conditions can be seen when the woman has diabetes mellitus. Diagnosis of diabetes mellitus, that is done by FBS, fasting blood sugar or fasting blood glucose. Soon after waking up without consuming any glucose, we need to take the sample of our blood and perform the examination. If it is around 90 mg percentage, it's okay. If not, it is more than that, then the person has diabetes mellitus. Apart from this, there are different tests too, like RBS, random blood sugar, or PPBS. This RBS and PPBS is performed after consuming the glucose, and at this time the count can be around 120 mg percentage, but more than this is again a problem. More than this again indicates the person has diabetes mellitus. The management for these two condition is based on the risk level. If the risk is very low, that is the count is around this, then the risk will be very low. It can be managed by the process of diet, that is non-pharmacological method is enough if the risk is very low. If the person has more risk, there is a problem in further, it may affect the delivery process and all, then we use pharmacological methods. We provide insulin to the mother. Management during delivery is very important. We will wait till the delivery is happening on its own. If not, we will perform C-section. And one thing, during the delivery process, we will make sure the sugar level, that is the blood glucose level, should be around 80 to 100 mg. If not, for the maintenance purpose, we will provide the medicine. That is, for the 1 liter of 5% dextrose, we will mix 10 U of soluble insulin. We will already mix it and we will keep it already prepared. And then we will keep on monitoring the blood glucose level. If the rating is around 70 to 130 mg, then we will provide 1 U per hour. If it is 130 by 160, then we will provide 2 U per hour. If it is 160 by 200, then the count we will provide 3 U per hour. Like that, based on the count of blood glucose level, we will provide the insulin. Pregnancy in Rh negative women. See, blood has three things mainly: RBC, WBC, and platelets. So, generally, we can assume that blood has a property of protecting us from the antibodies. If mother has any problem, the baby in the womb send its cell to the mother and protects the mother from the illness. If baby has any problem, mother send its cells and antibodies to protect the baby from the illness or any damage or any infection. This function is performed in the pregnancy period, but it is only performed when they both share a similar kind of features, similar kind of system. If, for example, mother has Rh negative in the blood and fetus has Rh positive, then automatically the mother antibodies think the baby's antibodies are foreign particles like viruses or bacteria, and mother itself start to kill her own fetus. See, when they both share different Rh, then the mother antibodies thinks the fetus antibodies or fetus has an foreign particles and send its antibodies and hemoglobin that passes the placenta and reaches the baby, and they start to kill the baby. Beginningly, it will come in the form of anemic, blood will be reduced, then heart functioning will be reduced, then automatically edemus, and inside the uterus itself the fetal will be dead. To find whether the mother and baby are sharing different Rh, or to find whether the mother is killing her own child or not, we have a test called comb test, that is indirect comb test. In our body, if we find any kind of foreign particles, then automatically our blood starts to produce large amount of antibodies, and mainly in this condition Rh isoimmunity will be produced in a large amount. By seeing that count, we will get to know whether their system is okay with both or they are not okay with both. In management, we will follow a process. First, we will see whether father and mother are following which kind of Rh. If, for example, mother has negative and father has negative, then no need to worry. The chance of fetus having positive Rh is very less. So we can follow normal pregnancy measures. If, for example, mother has negative Rh and father has positive, then at the time of pregnancies, the routine checkup will be going on monthly wise, right? At that time, the screenings will be performed. The first screening will be around 20, next 24th week, next 28th week. In every week, the screening will be performed. For example, if the screening is coming negative, then we will provide anti-D immunoglobulin injection, which is of dose 300 mg. While if it comes positive, we will provide an injection to sensitize or to suppress the action of Rh. I'm sorry, because there is nowhere the suppression injection is mentioned here. The name of the injection is not mentioned here. So I can't provide the perfect name of the name, but for the treatment purpose, they will provide a suppression injection to reduce the action of Rh negative thing. This antibiotics to kill the baby which is produced, we will stop the production of it. And one main thing, during the antibiotic screening, on the result, if you see, if you get the count of 4 4 IU by ml if you get, then there is no problem. You can follow, it's a negative sign. If you get above 10, then there is a problem which indicates it's a positive. It's all about management of RH negative.
Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.